Hey everyone, it's Hannah with the Rocket Miner. Today I want to give you some news updates that we had today about COVID-19, the vaccine, and where things are at in Wyoming. Just wanted to go over those with you. So first off, the biggest news today was that the US is recommending a pause in using the single-dose Johnson & Johnson COVID-19 vaccine. This pause is in order to investigate some reports of rare but potentially dangerous blood clots. Today, the Centers for Disease Control and Prevention and the Food and Drug Administration announced that they are going to be investigating unusual clots that occurred 6 to 13 days after vaccination with the Johnson & Johnson vaccine. The FDA commissioner said that she's expecting this pause to last a matter of days. So in connection to that pause and following the recommendations, the Wyoming Department of Health asked today that Wyoming providers also temporarily cease administration of the Johnson & Johnson vaccine and wait for more recommendations from the CDC, the FDA, and the Advisory Committee on Immunization Practices. So the reports of these blood clots were from 6 individuals. However, more than 6.8 million doses of the Johnson & Johnson vaccine have been given so far in the U.S., and obviously 6 out of 6.8 million is a very small percentage. And the vast majority of the Johnson & Johnson vaccines that have been administered have had no or just only mild side effects. So they're investigating to see if these clots could be related to the vaccine, if it could be a concern, but they are pausing so that they can look into that. They also noted Dr. Ann Schuschott, I'm probably mispronouncing her last name, I'm sorry, but she's with the CDC. She noted that authorities have not seen any similar clots after the use of the Pfizer or Moderna vaccines. Where we're at in Wyoming with Johnson & Johnson, as of yesterday, the Wyoming Department of Health is reporting that there have been 9,513 doses of the Johnson & Johnson vaccine given in Wyoming. 540 of those were in Sweetwater County. Because of this pause, Sweetwater County Public Health announced today that they had previously scheduled some Johnson & Johnson clinics coming up at the end of this week. Due to the recommendation and the pause, they will still have those clinics, but they will not use the Johnson & Johnson vaccine. Instead, for the clinics at the end of this week, they will be using the Pfizer vaccine. Some things to keep in mind and to think about with this news and with this announcement and this pause is, as I said, the cases they're investigating, the reports, are from 6 individuals. There have been 6.8 million, more than 6.8 million doses of this vaccine given out. So even when you look at the vaccine AstraZeneca, which has not been approved in the US, but it's been used in other countries, and there have been similar reports of looking into reports of blood clots that might be linked to that vaccine. Obviously, even with this, with just the 6 reports so far, it's an even smaller percentage. There are so many other things that we do every day that have a much higher risk of blood clots. Things like taking birth control pills, things like smoking, those all have a much higher known risk of blood clots, and people continue to take that risk and to do them all the time. I'm not saying that blood clots aren't serious or devastating. Obviously they are. I am aware of the tragedy of the 6 individuals who had the blood clots after the Johnson & Johnson vaccine. It is something that's serious and that should be considered, but just to keep in perspective that there are similar risks that are much higher that we take on a regular basis. Also, getting COVID-19, having the virus, having the disease, has a high risk of getting blood clots, especially later, and as we study long-term effects of COVID, that is one of the long-term effects that people are seeing is the risk of blood clots, and it's much, much higher than the risk we've seen with any of the vaccines. So it's just something to keep in mind, to keep perspective on the situation and what it could mean. As I said, I think it's good that they're taking a pause, that they're evaluating the Johnson & Johnson vaccine, making sure that we do things as safely as possible and have as little risk as possible. But also with that, I'm wondering if people will look at this and have more hesitancy about getting the vaccine in a general sense. But as the CDC noted, we have not seen blood clots or any effects like this following the Pfizer and Moderna vaccines. So I would encourage people who are thinking about getting the vaccine and now maybe heard this news and like, oh, maybe I shouldn't get the vaccine. Pfizer and Moderna are still safe and effective, and I would still encourage people to get those vaccines. I think the risk from getting COVID itself is much worse than any risk associated with the vaccines. So that is happening. It's something to be aware of with this pause and reevaluating Johnson & Johnson, but as I said, I just want to give a little perspective to think about what this means and to not either blow it out of proportion or just to be able to be informed in the way that we respond to it. Also connected to COVID-19 in Wyoming, today the Wyoming Department of Health announced that the 2 remaining statewide public health orders that are still in place are being extended for 2 more weeks, which will take us right to the end of April with those. One of the health orders has to do with regulations for schools, and the other has to do with large indoor events and crowd sizes. So with extending these orders, mask use and physical distancing requirements related to educational institutions are remaining in effect in the orders. So that will go through the end of the month at least. And then also indoor events of more than 500 people can be held at 50% of venue capacity with certain face mask protocols for large indoor events. That's what the second health order deals with, is those large indoor gatherings. So those are continuing. Those are the ones that have been in effect, and they're just extending that through the end of the month now. Also, although there is no longer specifically a mask mandate in place, the Wyoming Department of Health is recommending the continued use of face masks, especially in indoor public places and when common sense physical distancing cannot be maintained among people who don't live in the same household. So masking is still very much encouraged, especially in indoor places and in gatherings and places where you can't distance with other people. Related to looking at the health orders and choosing to extend them through the end of the month, State Health Officer Dr. Alexia Harris made this comment. She said, "While we continue to see stable case numbers and hospitalizations in most areas of the state, our overall progress seems to have plateaued. COVID-19 remains a threat for now, with cases growing in other states." So we are still doing pretty good in Wyoming as far as our numbers go. But obviously, as Dr. Harris said, it is still, with us, it's still a threat, it's still a concern, something we have to deal with. And even though we're still doing pretty well in Wyoming, other states are seeing increases in cases, and obviously that affects people as they travel or come through the state. So we still need to be aware of what's happening, we still need to be careful and do what we can to continue to stop the spread of it. So as she said, our numbers are kind of plateauing. What that looks like in Wyoming is that we're staying right around 400 active cases in the state. That's been the case for the last week or so. As of today, Wyoming has 457 active cases, so that's up a little bit from where it's been. Today also, the Wyoming Department of Health added 2 more COVID-related deaths to Wyoming's total. They confirmed those as COVID-related, so that brings our total to 703 deaths in Wyoming. So obviously this virus is still with us. It's still something that we need to be aware of. It could still very easily jump back to really high numbers if we aren't careful and continuing to do as much as we can. So I would just encourage people to remember, even when you think about things like the vaccines and any risks that might be associated with them, look at the risk compared to COVID-19 itself. Look at how many people have died from it. Look at the continuing long-term effects we're seeing in people that have had it, and just think about the risk that it itself presents. And personally, I think that risk is much higher than any risks that might be associated with vaccines or any precautions we have to take. So just be aware of what's going on, make informed decisions with it, and I hope that people will continue to do their part, do as much as we can to protect yourself and protect each other. So thank you for listening, and keep checking with us for more news and updates, and I hope that everyone has a good evening.